I would specially thank Mr. Veeraswamy, Mrs. Veeraswamy and his family for accepting our invitation to do what I think is a social service. நீங்க பாத்தீங்கன்னா இங்க ஏஜ் நோ பார்னு போட்டிருக்கு. And that is what we are trying to do. We are trying to say that in any surgical procedure which is essential, age is no longer a bar. If somebody has a problem which has to be solved, we do not look at the actual number of the age. That is not necessary nowadays because technology and medical science has progressed so much. We operated on Mr. Veeraswamy for a condition called trigeminal neuralgia. I'll just give you a small brief on what it is and then you can hear from the patient himself on what he suffered. But I'll just give you a small background on this. We have a nerve called the trigeminal nerve which takes sensation from the face to the brain. So this is called the trigeminal nerve. So all sensation from the face, from the left side of the face goes to the brain, right side of the face goes to the brain. And trigeminal neuralgia is a pain condition where you have a shock-like pain. It's an electric shock-like pain. Somebody who has not suffered it cannot imagine that pain. It's a shock-like pain which comes by anything. You touch the face, you get the pain. There is the AC blast, you get the pain. You open your mouth, you'll get pain. You try to eat, you'll get pain. So any sensation is felt like pain. And this is called trigeminal neuralgia. How do we diagnose it? It is only by what the patient says that we make a diagnosis. It's very classical. ஒரு தடவை ஒரு பேஷண்ட்டை நீங்க பாத்தீங்கன்னா their story நீங்க கேட்டீங்கன்னா all of you can diagnose trigeminal neuralgia because it is so classic. And then we do an MRI just to make sure the patient's cause for the trigeminal neuralgia, what is it? Is it a tumor? Is it something else? Is it fluid? What is it? So that we don't miss any problem that is causing it. Most often, if there is no tumor, cyst or anything, the cause is what is called neurovascular conflict. Medically, that's a big word. But basically what it means is that there is a blood vessel which is sitting in direct contact with the nerve. Now, so what? It is a normal blood vessel, normal nerve. But the problem is that the pulsation of the blood vessel. When a pulsation goes on hitting a nerve, the nerve gets irritated. If somebody sitting next to you goes on tapping you, for some time you will be quiet. அதுக்கப்புறம் இன்னொரு பக்கத்துல யாராவது உட்காந்து ஏதாவது ஹலோன்னு சொன்னாலே சல்லுன்னு விழுவேன். அதே மாதிரி the blood vessel is pulsating and irritating the nerve so much that any sensation which the nerve gets, it is transmitted to the brain as though it is pain. And this is what is called trigeminal neuralgia. The cause is the blood vessel which is hitting on the nerve. And therefore all sensation is felt like pain. Now how do you treat this generally? Generally the first and the best treatment is medicine. And there is only one medicine which actually works. That is called carbamazepine. That works. It should be given in small doses, starting with small doses. But there are some patients in which the medicine does not work, or despite taking a lot of medicine, the patient still gets pain, or medicine side effects happen, therefore the patient cannot take. And this has to be taken lifelong if you are going to take medicine. So very often patients, when they are young, they start it very enthusiastically, but somewhere along the way, "Adha vali illiya nirthidlam." So they stop it. So the pain comes back with a rebound, which is almost double, and then becomes very difficult to control. So when the patient's pain does not get controlled by medicine, you have to have some procedure or intervention. That is very clear. Now, what are the types of procedures and interventions? One is surgery, which is called microvascular decompression, which I am going to talk to you about, which we have done on Mr. Veerasamy, which is physiological, which means all that we do in the surgery is, I told you there is a blood vessel on the nerve. All that we do is move it away from the nerve. Simple. Normal blood vessel, normal nerve. We don't destroy anything, we don't cut anything, we only move it away. That is physiological. We are not damaging it. There are a lot of other procedures which are so-called minimally invasive because they use needles and other things, but which destroy. So therefore they are called ablative procedures. So they are destructive procedures. It can be glycerol injection, radio frequency, gamma knife. There are many like that which are available. But in my mind, I do not like to destroy what nature has given normally. Why should you destroy? It is so easy to destroy but very difficult to build. So the microvascular decompression surgery is something which should be done and gives the best long-term results. That is also important. This gives the best long-term results of all interventions. Other interventions give good results, but most often they have a high recurrence rate. So what do? We make a small incision behind the ear. And then we make a small opening in the bone. Mr. Veerasamy, if you look at him, meet him in some wedding reception, you can't even know that he's been operated. Because you can't see it on his face. And then, if this is the blood vessel which is hitting on the nerve, we move it away and put some muscle, which is tissue which is locally got from the incision, to move the vessel away. So this is from another person's surgery, where if this is a blood vessel, this is the nerve. So this surgery is done with the operating microscope under very high magnification. Appadina, something which we see, we magnify it about 10 times, 15 times. An example is, I'm sure all of you have seen the movie Dadapati. Have all of you seen? Yes?
Yes, sir.
There is one scene there where Rajinikanth is following his mother into the temple. And Ore or Mallipu falls on the floor. Remember that scene? And then the camera zooms into that Mallipu so that the entire field or entire screen is only that Mallipu. So what happens, you can see all the details of the Mallipu. And that is what is microscopic surgery. Clear that? So you can see every detail, and that is the best part. So when we see like this, it is not so big, it is actually small. And the instruments which we use are less than a millimeter in size at the tip. They are 0.3 millimeter, 0.6 millimeter on the madri. So they are very fine. And therefore this is how we see it, and the nerve is pushed away. So you can see a nerve sometimes, you can see it is like a groove here, it is almost like a hill here. The nerve, that's badly affected, and then it becomes very nice here. Now Mr. Veerasamy had a MRI like this. You can see this long black thing, that's a blood vessel. He had a large blood vessel which was pressing on the nerve. And this is his surgery. I'm sorry, Mr. Veerasamy, I'm showing you your surgery. I hope you don't mind. So, we do this like this. The large vessel is here, and that's the nerve, right, which is pushed right on top. So under very delicate circumstances, we operate. That's the basilar artery there, and then we push the tissue between the nerve and the vessel and move it away. So there is no need to worry. This is the message which I want to give. There is no need to worry if there is trigeminal neuralgia, because there is a long-term solution.